Okay, we're continuing with the book here, Hidden History of Nutrition, Health and Science by me, Pete Rogers. We're on page 47 if you're following along in the book. We're going to talk about Roy Swank. Roy Swank has the best results of any doctor in the world for the treatment of multiple sclerosis. He's a Harvard-trained MD PhD. And he came to the conclusion that the most important thing for the treatment of multiple sclerosis patients is to reduce the dietary intake of saturated fat. And he found that you really have to get it down as low as you possibly can. A small increase in sat fat and the patients had much worse outcomes. He followed in a published paper like 32 years of follow-up with MS patients, and the ones he diagnosed early, 95% of them, they never progressed. Those are incredibly good results. In comparison, other MS patients, they tend to often progress, routinely progress, and are severely debilitated in 10 years and dead, not too long after that. I can tell you neurologists don't know about Roy Swank. I've been amazed. I talk to neurologists, and they're like, they don't believe it. Nutrition, help MS, I don't believe it. Literally, I've talked to MS experts, and they don't believe it. He followed him up. He was in Canada for a while, then he went to Oregon, and he did a lot of work on blood sludge. Yeah, he looked with with microscopes and made videos of blood flow. And he saw the blood sludging together after a high-fat meal. Again, he put his emphasis especially on saturated fat. Later on, other doctors like Meyer Friedman and Ray Rosenman showed that you get the same thing with PUFAs, polyunsaturated fatty acids, meaning eating oils, omega-6 cooking oils, okay? And there was additional work on that, like Dr. Gregory Sloop. So it's been shown that chylomicrons cause blood sludging. Red blood cells have a negative charge on their outer surface. Here, let me get a red cell. This little thing is a bullshit meter, but it basically looks like a red blood cell. It'll have a negative charge all around the surface. You could type this into your computer browser. RBC for red blood cell, Zeta potential. They all have a negative charge surrounding their outer surface. It's formed by a combination of the alternating sugars, disaccharides. They're also called glycosaminoglycans. Things like heparan sulfate. They got lots of sulfates sticking up. They're all negatively charged, okay? There's also cholesterol sulfates in the glycocalyx. And at the end of the glycocalyx, there's sialic acids that are negatively charged. So that gives the red blood cell a negative charge on its outer surface. The negative charge is called the zeta potential. In my opinion, the beginning of wisdom about blood flow comes from understanding the zeta potential. Okay, everything in the blood has a zeta potential. The white blood cells have a zeta potential. The arterial lining cells, the endothelial cells have a zeta potential. And there's a very good reason for it. They all have negative charge, so they all repel each other. Nothing sticks together. Even the most common blood protein, albumin, has a zeta potential, a negative charge, so none of this stuff sticks together. Brilliant design by God to prevent clotting, because in real world, people die from clotting, okay? In the movies, people die from bleeding, but in the real world, people die from clotting, okay? That's the most common cause. It causes heart attacks, causes strokes, tissue ischemia, causes cancer, okay? That's the Warburg effect. Anyways, Roy Swank did things like he measured the oxygen level in the tissues after a high-fat meal, and he found there was as much as a 30% drop in the brain of a hamster, okay? And other people had shown, there's Peter Quo showed about 15 to 20% drop in oxygen the way he had measured it. Meyer Friedman and Ray Rosenman were especially looking at the eye with 80-fold magnification, and they would see blood flow stop in some of the capillaries, for example. Okay, so anyways, Roy Swank felt that somehow the tissue ischemia was damaging the blood-brain barrier, and he thought that was a mechanism whereby antigens could then get access into the brain, and that could lead to an immune reaction and lead to the damage we find with multiple sclerosis. So that's his theory number one of multiple sclerosis. There's additional theories of multiple sclerosis, including like the dentist theory. Some of these dentists, like Hal Huggins, Robert Gamal, they found that if they would take out mercury amalgams, the patient's MS would often improve. So they thought it was the bidirectional veins in the face going to the jawbone, the maxilla on top, the mandible on the bottom, and that blood flow, because your brain has bidirectional veins, so it can drain no matter what position, in your stomach, backside. And they felt that the mercury, it's volatile, it comes out of the tooth, it has no charge on it, so it can cross the blood-brain barrier, get into the brain. And they felt that their reactions around the veins, most MS lesions are right around the periventricular veins that are perpendicular to the cerebral ventricles, the lateral ventricles. And they felt that this was an inflammatory reaction primarily and only secondarily demyelination, removal of the cover of the white matter there, axons. So that's the other big theory of MS is dental amalgams. There are some other people who think aluminum is a major contributor to it based on autopsy studies finding some aluminum in the brains, increased amount of aluminum in the brains. Okay, that Mr. Aluminum believes that, Christopher Axley, for example. Okay, those are some of the big theories, all right? And of course, leaky gut is part of the theory that kind of goes with Swank, because high-fat diets, including high-saturated fat diets, they increase the risk of leaky gut. They also tend to be low in fiber, which increases the risk of leaky gut. When you got leaky gut, you got leaky blood-brain barrier. So all these things go together. They're not mutually exclusive, and you could have more than one thing causing it. There were some dentists who felt that the number of multiple sclerosis lesions were more common if the patient only had dental amalgams on one side, suggesting that it was that venous bidirectionality mechanism of allowing mercury to get access to the brain. So anyways, but Roy Swank's research is pretty impressive. By just minimizing saturated fat, he got fantastic results on long-term follow-up with his patients. Another interesting thing is Roy Swank traveled to China around 1960, and they couldn't find him an MS patient. They couldn't show him an MS patient. That's how rare it was, if it even existed at all, back when they were eating about 90% of their calories from white rice, and then they were eating the rest of their calories largely from vegetables and then some fruits, for example. All right. Let's see. Oh, another lady who's very interesting for MS. Blood sludge is also called rouleau formation, stack of coins. Chylomicrons will stick them together. Triglycerides will even end up in the long run causing them to stick together. Okay, this lady, Drs Stancic, MD, she also wrote a book very good about multiple sclerosis. She herself had MS. I think she was like a infectious disease fellowship trained doctor, and she couldn't move her legs one morning when she woke up from being on call, and she was doing very poorly. She was in her 30s, she's in a diaper, she's debilitated, told she's going to die soon, be a cripple for the remainder of her life, and it was only going to get worse. And then she read an article saying, oh, gee, patients who eat blueberries and fruits have better outcomes with MS. And she's like, that's interesting. Then she found a twin study, and in identical twins, quite often one of them didn't get it. So she's like, it can't just be genetic if one of the twins doesn't get it. It has to be environmental. And this research on plant-based diets getting better outcomes with MS, they seem legitimate. So she started going, ended up becoming a vegan, and she got dramatically better. She got so much better that she could go back to work. She's been working for like the last 25 years. And she was kind of funny. She talked about how she got sick, like in residency and fellowship. She said that basically residency and fellowship train a doctor to become sick. They're totally sleep deprived. They're staying up late at night on call. Typically Q3 call is pretty routine for residency programs. Surgeons often take Q2 call, being on call every other night, often up most of the night. So they're totally sleep deprived. They're totally stressed out. And they totally eat tons of junk food. They practically live in the hospital. The drug reps used to come a lot more often than they do now, so they're constantly getting fast food, catered fast food, junk food, processed food from these drug reps, buying it from the vending machines, going to the hospital cafeterias, which typically would have lousy food. I did a surgical internship back in those days. I was on call every third night, and I would eat from drug reps and from cafeteria processed food all the time. That was routine. Stressed out, up late. Okay, so anyways, all of that makes a person unhealthy. So now she says, as an MS patient, she eats a low-fat vegan diet. She goes to bed very early to make sure she gets her sleep. And then she even ran a marathon. Exercise was part of her recovery and helped her a lot. So that was quite interesting. So the good news about all this is patients can have dramatic improvements by doing this stuff. And I've never heard any neurologists other than Roy Swank talk about this stuff. Dr. McDougall was good friends with him and worked with him and did some research along those lines as well. But it's good to know about this. There's good reason for autoimmune disease patients to be hopeful, and this is a big part of treatment. Oh, the other thing too they learn as a resident and a fellow is to drink lots of coffee. It's routine. Doctors drink tons of coffee. She said, here she was taking dozens of pills for years, and just getting sicker and sicker. She's in a diaper, walking with a walker on crutches. Okay. All right. So that'll be it for today. That little discussion of multiple sclerosis. Hope you found that helpful. And Roy Swank and Drs Stancic.